Hey, welcome back to Not So Complicated, and this is episode 9 of 5 Minutes 5 High Yield Drugs, including musculoskeletal systems drugs like Ibuprofen, Prednisone, Methotrexate, Alendronate, and Allopurinol, right? So, the first drug is Ibuprofen. It belongs to non steroidal anti inflammatory drug, NSAIDs, and the indications are osteoarthritis, rheumatoid arthritis, acute musculoskeletal pain, and fever. The mechanism of action is it reversibly inhibits cyclooxygenase 1 enzyme and cyclooxygenase 2 enzyme, reducing prostaglandin synthesis. The synthesis of prostaglandin actually occurs in the first place from arachidonic acid, so that is reduced, right? And this will decrease inflammation and pain. The side effects are GI bleeding, and that is why you have to use PPI like omeprazole, pantoprazole to reduce the risk of GI bleeding and renal impairment, and also increased cardiovascular risk with prolonged use, right? The USMLE poll for this drug is that we have to avoid in peptic ulcer disease because it has a risk of GI bleeding, obviously, and CKD because it has also nephrotoxicity risk. We have to use it PPI for GI protection, and ibuprofen is preferred over aspirin for musculoskeletal pain due to less GI irritation. You have to remember this. The other drug is prednisone, belongs to glucocorticoids, right? Glucocorticoids are not used in viral infections because it exaggerates the lesions, so that is why. And the indications are autoimmune conditions like rheumatoid arthritis, polymyalgia rheumatica, and lupus flares, right? The mechanism of action is that it binds cytosolic receptors, inhibiting pro-inflammatory cytokines like interleukin 1 and tissue necrosis factor alpha, reducing inflammation. Side effects in long-term use are osteoporosis, hyperglycemia, Cushing's syndrome, there can be adrenal diabetes, and also adrenal suppression with long-term use. The USMLE poll is that whenever you decide to stop this drug, you have to taper it slowly because it has a risk of adrenal crisis and abrupt withdrawal of this drug. And for rheumatoid arthritis, you have to use as a breeze while awaiting DMARDs like Methotrexate. DMARDs is disease-modifying anti-rheumatic drug. We'll talk about Methotrexate. And we have to monitor for bone loss because obviously osteoporosis risk, and prescribe calcium and vitamin D. The other drug is Methotrexate, including DMARD, right? The class is DMARD. The indications are rheumatoid arthritis, psoriatic arthritis, and juvenile idiopathic arthritis. The mechanism of action is that it inhibits dihydrofolate reductase enzyme. So we have to be serious when using methotrexate in pregnant women because if the folate deficiency occurs in pregnant women, there can be a very high risk of development of neural tube defects in the fetus, right? So that is why. And reducing purine synthesis and T cell proliferation, dampening autoimmune activity. That is the mechanism. The side effects are hepatotoxicity, bone marrow suppression causing pancytopenia also, and also pulmonary fibrosis. The USMLE poll is that always give with folic acid to reduce toxicity, and monitor liver function tests, obviously hepatotoxicity, and CBC because of bone marrow depression, contraindicated in pregnancy due to teratogenicity. I have talked about it, like fetal abnormalities, right? The other drug is Alendronate. It belongs to class bisphosphonate. The indications are osteoporosis. Anything that has lesion in bone are the indications. So osteoporosis, Paget's disease, and glucocorticoid-induced bone loss. The mechanism of action is that it inhibits osteoclast activity, reducing bone resorption and increasing bone density. The side effects of this drug are that esophagitis because of esophageal impact. So that is why you have to stand up like erect while having this drug, right, to reduce the esophageal impact. And also osteonecrosis of the jaw and atypical femoral fractures can happen. So USMLE poll is that you have to take this on empty stomach, sit upright. I have talked about it why, for 30 minutes to prevent esophageal irritation, ensure adequate calcium and vitamin D intake, and contraindicated in esophageal strictures or severe renal impairment. So the other drug is allopurinol, xanthine oxidase inhibitor. Indications are gout, hyperuricemia, and tumor lysis syndrome. Tumor lysis syndrome, we have talked about it in our lectures of general principle pathology. You can check it out. The mechanism of action is it reduces uric acid production by inhibiting xanthine oxidase, preventing urate crystal formation, right? So the side effects are rashes, Stevens-Johnson syndrome, this is adverse drug reaction type 2, and allopurinol hypersensitivity syndrome, right? the USMLE poll are that we can't start during acute gout flares. It worsens inflammation, and we have to screen for HLA-B5801 in high-risk populations to avoid severe hypersensitivity, and use fevoxstat as an alternative if intolerant. So that is all for today. Subscribe for daily doses like this. Thank you.